We running.
Okay.
Let's talk about it.
Hi, I'm Janie,
And I'm Dan.
and we're Achieve the Lifestyle. And today we're going to start a series that we've been thinking about called It's Fine.
It is fine.
And so I'm sure we're all familiar with the passive aggressive term when somebody really doesn't like something or they don't agree with something, but they just say it's fine.
Yep.
It's fine.
Like you're gonna go along with it, but you're really not,
Right.
and you're not happy about having to go along with it.
Right.
So it's fine. It's okay. We're not gonna pay attention to it.
And so today we're going to start this series with talking about heart disease and how heart disease is so prevalent in the US.
It is the number one killer of Americans year over year without fail by a very good amount. Second to heart disease would be cancer, but heart disease always takes the title of
It's the man on top.
The man on top, number one killer of Americans, and it has been for a long time. The jury's out on is on if it rises year to year as well. So it kills more people every year than it did the previous year. More to follow on that number. That's what I was trying to look.
Yep. And so basically, heart disease took top rank after the invention of antibiotics and adoption of soap, washing our hands. So infections drastically decreased. There is some play with the timeline of, the 1950s is when heart disease kind of took off. Some other things happened in the 1950s, such as the Ancel Keys study, which demonized cholesterol from animal meats. So meat consumption went down.
And your current USDA approved food pyramid, which we all know to be largely misinformed and obsolete, better word trash, is based on the Ancel Keys study.
Right.
It's the 7-country study, if you never heard of it, where we decided that we should eat grains instead of, so basically more processed food, where grains became the majority of the recommended diet for Americans. We also know, if you didn't know, that Ancel Keys was paid to come to that conclusion.
Okay. Yes. And his study cannot be reproduced, therefore it's not
an actual scientific study.
Right.
Yeah. Nobody has ever been able to reproduce his results.
And so heart disease seemed to peak 1960, right? So I said it started to increase in the 50s. So 50s, you have the Ancel Keys study. So Americans are being told, stop eating meat, start eating these grains. So then we have increased intake of processed foods, high glycemic carbohydrates. Smoking took off as well, too, at that time as well. So I'm going to say as well a few more times. But smoking increased at that time.
That's Rollo.
That's Rollo's dreaming.
He's dreaming, taking a nap.
Also, the introduction of automobiles, so us Americans naturally became less active because we started driving more. So all these things happened in the 1950s. Heart disease peaked in the 1960s. So if you can't tell, what seemed to skyrocket heart disease? Lifestyle choices.
Mm-hmm. So therefore, way less movement, more convenience, less movement.
Yeah.
Coincidentally.
And smoking.
And smoking, of course.
Therefore, one could say heart disease is preventable. You could say.
Yeah, I think, I mean, you probably know, like a lot of the congenital stuff in hearts.
Well, yeah, I mean, we're not talking about that. There are congenital heart diseases, and heart disease is a very broad term. You're talking heart attacks, coronary artery disease, which leads to heart attacks, congestive heart failure, sudden cardiac death. So there are these things, but I'm mostly talking about the things that lifestyle promotes, the things that are not handed down to you purely from genetics, because that's the majority.
Well, yeah, exactly. Like if we were to take 10 heart attack victims, it's safe to say that at least 9 of them would be stuff. Guard dog boy Rollo.
So he's mad about this as well.
Okay, yep. I know, Rollo. It pisses you off too. I know. So it's safe to say if we Rollo. So No, he doesn't want me to make that point. Rolo, you work for Ansel Keys or what? What's going on?
So he likes his grains.
9 out of 10, if we were to take 9 out of 10 people that had a heart attack that show up to an ER with a heart attack, would it be safe to say that a lot of them were going to be suffering from things like obesity, high blood pressure, what have you?
Yeah, I would say that, yeah.
Yeah, that's probably a safe assumption. Like, you didn't get a heart attack for the most part because you were doing really all these great things, and then all of a sudden some congenital thing that you didn't know about happened to strike at that moment. That happens, and that's part of the numbers, but that is not the majority of the cases that we see when it comes to these heart disease numbers.
Right. Agreed.
Okay. So it is safe to say, it is safe to make the assumption that heart disease is generally a preventable issue related to lifestyle choices.
And heart disease after the 60s started to decline. And it has been declining subtly, and it's kind of where we're at now. This is large in part due to the fact that, in the 1950s, if somebody had a heart attack, that was a death sentence, they're done. Now, if somebody has a heart attack, I mean, how many people do we know that have had 1, 2, 3, 4, 5?
I know somebody who had 5.
Yeah, and so medical advances, and this is where Western medicine's amazing. Medical advances have been able to keep people from dying if they have a heart attack.
Yep. Okay, like if you have a heart attack, they get you to the hospital in time, you're probably going to be all right with the way things are. Medical technology is nowadays.
Right, and also the drastic decrease in smoking. Smoking's not as popular as it was in the 60s and 70s. So that's coming down. And Dan and I kind of conflict on this. I did see a study saying that, people are trying to be more active, whether that's more active than it was before cars. I don't know. I don't have that result. Dan's like, no, people are inactive. But I also think that the definition of what activity isn't consistent.
There, now you're thinking like me. So if being more active, by saying I'm being more active, means that you watched fucking 5 hours of Netflix and then you went on a walk around the block for 10 minutes, then that is not what the fuck I'm talking about. You're still in the inactive category in my book. I think we are, if we were being more active, the numbers on metabolic syndrome would be lower. When we know that 88% of people suffer from some sort of metabolic syndrome and 70% plus of Americans are overweight or obese, those numbers I feel like would be lower if we really were trying to be more active. Right. And we would have physical education in schools and all this other stuff that would actually support that. Right. So I think we are not being more active. I think we're being more sedentary. Even people that would claim to be active might fall into the sedentary category.
Like, what did I have a couple friends who called them, I think my friend Laura called them CrossFit couch potatoes.
Yes.
So they do CrossFit, or so you don't have to do CrossFit, but you can do an hour of exercise, 30 minutes of exercise, but then you go home and sit on your couch, and that's the majority of your activities on the couch, but yet you exercise for 1 hour. Yep. Which, it's better than nothing, right? But does it move the needle on preventing heart disease? I don't know, right? So some people say that, what about the introduction of statins? Because statins, lower cholesterol, that'll decrease heart disease, correct? Well, not really, because we did a post recently that said, 70% of people who presented to the hospital with heart attacks had cholesterol within normal levels, whether they were on statins or not statin naive. I don't know. I didn't, that didn't differentiate that. But the thing is that regardless, their cholesterol was normal.
It wouldn't matter if they were on statins at that point.
Yeah, exactly.
It was normal, whether medicated or not, normal cholesterol still had a cardiac event.
Yeah, and so also I read in a study that with the decline of heart disease, with the introduction of statins, the decline was no different with statins than it had been 20 years prior. So did statins really help, or would that number have declined regardless of statin use? Unable to determine.
Yeah.
So which here's where it's fine comes in, because when we see what was related to the increase in heart disease, the top 3 out of the 5 things, so smoking, saturated fats, doesn't say where from, high glycemic carbohydrates, processed foods, and decreased physical activity, high glycemic index and processed foods, those are two very prominent things, and decrease in physical activity. So 3 out of the 5 major reasons listed for the increase in heart disease are things that don't necessarily affect cholesterol. They affect insulin sensitivity, insulin resistance, and blood sugar, right? Though, when we screen for heart disease, we look at cholesterol. We don't think to look at blood sugar in relation to the cholesterol. And we don't screen routinely for insulin resistance. We do not. And you can say, well, if somebody's blood sugar is elevated, then that can lead you to think that they're insulin resistant. I understand that, but if we screened insulin as part of a general workup, we would know much sooner if somebody was heading down that pathway. So the fact that in the medical field, we know this, we know that insulin resistance causes hypertension, which can lead to heart disease. We know that insulin resistance can cause inflammation in the arteries, which then cholesterol comes and patches up and leads to a clot, heart disease. We know that insulin resistance leads to diabetes, but we don't screen for it. It's fine.
Yes. My it's fine is that there is no push to increase physical activity for people. We never talk about physical, like the recommendations on exercise are as fucking casual as what have you. They're just, it's in passing. Oh yeah, if you do exercise, it's good for your health too. Okay, onto this other thing, which is probably more profitable and more lucrative for certain people, meaning medications and that sort of thing. Before we talk about, hey, you need to move more and move more with a purpose before we talk about what we're eating, okay, and the quality of the general food that we all have access to, which plays a part in this. Before we reconsider things like the food pyramid, we go straight for the medical intervention. Now we're telling people that you're healthy at any size. We're telling people that obesity is genetic and there isn't much that you can do about it. So you see how we're really, really shy, even though there's no downside to adding more movement to people's lives. Zero downside. Like, I dare you to give me a side effect of more movement. You won't find one. And give me a negative to more movement. You won't find one. And we're kind of giving that thing the elbow and telling it to get out of the way so we can present these medical interventions that are more expensive and more complex and come with side effects. And we seem to be, the mainstream information keeps pushing towards that and giving the exercise and nutrition thing the elbow. So it's fine. Hey, listen, if you got up off the couch more and you went on a walk every day and you actually paid attention to what you were eating, if we actually as a population, as a construct, we actually paid attention to our food sources and what's going in our food and what we're putting in our gullets every day and what we're giving people access to. Because honestly, listen, I believe that people should be able to go to the grocery store and pick something off the shelf and safely assume that is safe for human consumption. Okay, I believe that you should be able to do that, but instead you got to go to the grocery store with a damn near tinfoil hat on and wonder how what's on the shelf can fuck you up. That's how you actually got to go grocery shopping. Right. So all of that stuff, when you put it together, it makes it really hard to prevent heart disease. Makes sense? You got to be really on your P's and Q's, and you need people like us and people with more reach than us to let you know, like, hey, you need to pay more attention to what's going on around you so that you don't fall into these numbers. Yeah. But hey, it's fine. Yeah. No, we don't want to work out. It's fine. Right. We don't want to pay attention to food. It's fine. It's okay.
And so just to add more to that with the physical activity. So now the recommendations that healthcare providers are supposed to encourage patients to do for physical activity, they are better. Okay. So they're encouraging people to do 150 minutes a week of physical activity of low intensity, low or moderate intensity, right? So they say, take a walk. You should be like pushing hard, but you can still have a conversation. So 150 minutes a week. Or 75 minutes a week of strenuous physical activity. So that would be more like high intensity interval training or really pushing it. Strength training or resistance training, they do allude to a little bit. So, but here's my problem with that is that so say I wasn't physically active of my own, I didn't marry a strength and conditioning coach, I wasn't doing anything and I'm a healthcare provider and they give me those recommendations. How do I share with my patient of what are ways to get 150 minutes a week of moderate, light or moderate intensity? What are ways to get 75 minutes of high intensity? What do I tell a patient like, hey, you need to strength train? Bye, go figure that out. When I can just prescribe them a medication, their insurance can make it super affordable. Sometimes statins are even free, but gyms aren't. Personal trainers aren't. So it's we set healthcare providers up to give people partial information or insufficient information or insufficient tools, but yet we give them fully loaded medications, knowing how to use them, how to prescribe them, and ease of access for patients for these medications. So what the fuck do they think is going to happen?
Here's a question for you, because I think another one is like dietitians and nutritionists. Hey, I have this issue. I have high blood pressure. I don't know how to eat. I need to eat better. I want to go see a nutritionist. I want to go see a dietitian. Can my insurance cover that? Big no, unless you have this super premium plan.
Well, no,
Big no.
They do, but they don't reimburse the dietitian or nutritionist sufficiently, so you're not going to get your top tier ones.
And not only that, but it's very like you got to have a really good fucking plan to get that dietitian coverage.
Or
most people don't have a plan that will
or
take that.
To get nutrition or dietitian covered, you have to have the disease
already. That's the other one.
Yeah, so the prevention isn't there.
So if you're on your way, if you somebody that you see, you tell them like, hey, your A1C has been up there, like you're borderline, you're pre-diabetic, we need to do something about this now. Or your blood pressure is consistently elevated, we need to do something about this now. And that person's like, you know what, I might want to go see a dietitian because I don't know how to eat. They ain't going to cover that until they're sick.
Exactly.
Now, if that person came to you and said, I want to go on this medication, then you think they cover that?
Let's fucking talk.